Welcome back to State of the Union. Republicans successfully ended the shutdown. Now comes a really hard part, figuring out what to do about health care costs when enhanced Obamacare subsidies expire on December 31st. Here with me now is one of the president's top medical advisors, the administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Thank you so much for being here. Appreciate it. The president said he will be willing to talk about these subsidies once the shutdown is over. The shutdown is over. So is he willing to extend the subsidies at all?
I think the president's willing to look at all options, but we have some major flaws with the way these COVID-era subsidies were added. And just so everyone's on the same page in this issue, our goal is to get people covered. Especially we want people covered who are trying to work. They're trying to climb their way up financially as they get jobs and evolve. How do you do it wisely? So the original Obamacare had fundamental flaws in it. For example, when you make more than 4 times poverty, there was not an ability to get continued enhanced subsidies. But there are other issues that were also present that the Democrats tried in early COVID to rectify by throwing money at it. The problem with the approach that was taken, and if it was a great approach, I actually think they would have made those changes permanent. The fact that they're designed to expire now is reflective of the fact that the current system is not the system that anyone really thought would work long term. It creates incentives for fraud. And I'll just give you one example because I keep reading about this in different contexts, but you can understand it in a very straightforward way. Health insurance is different from other kinds of insurance. You don't want to use your fire insurance because you don't want your house burning down. Health insurance you tend to use every year. In fact, on average, 80% of people use their health insurance during the day. If you're watching right now, think about whether you filled a prescription, went to a doctor's office, you use your insurance. So let's say 20% of the time you don't use your insurance. That was also the number for the Obamacare exchanges. That number has now doubled. Doubled. We have last year 24 million people on the exchanges, 11 million people never filed a claim.
So I hear you talking